All right, well, welcome to Grand Rounds, Department of Psychiatry. I have the pleasure of introducing our speaker today. Our speaker is Derek Shum. He is currently a fourth-year resident in the program. He's also one of our co-chief residents. Dr. Shum graduated from the University of Kansas Medical School after receiving his BA in biology from University of Kansas. This is the one thing that I still have a hard time getting over with Dr. Shum, is that he is a huge Jayhawk fan. And in all honesty, I thought I thought I'd let it go, but I still have not let it go. He has done tremendous throughout his residency. We've been really fortunate to have him. One of his interests all along the way has been integrative medicine and how to incorporate that into a general psychiatry practice. He spent much of his year this year working with people both at the university and outside of the community with this particular interest in mind, and I think he's brought some really interesting ideas today. Today he'll be talking about the integrative treatment of anxiety, and Dr. Shum has nothing to disclose. So without further ado, I welcome Dr. Shum.
Is this okay? Yeah? Okay. Yeah, as Dr. Heron mentioned, I've had an interest in integrative medicine and integrative approaches really since medical school. Believe it or not, the University of Kansas has a program in integrative medicine, and as students we got a didactic series on the topic. And then during my third and fourth year here, I was able to work with a variety of patients through an integrative mental health model. And I chose the topic of anxiety because in my experience, anxiety is a condition that responds fairly favorably to integrative modalities. So the objectives and goals for this talk: first, I want to spend some time defining integrative medicine and integrative mental health, which sits within integrative medicine. And what we're going to find is that integrative medicine uses conventional and non-conventional approaches in the assessment and delivery of care. We're going to look at anxiety from an integrative perspective, and we're going to have a little bit of fun with this, look at some popular artistic depictions of anxiety and some quotes from famous individuals on the topic. We're going to discuss assessment and treatment planning from an integrative perspective, and then we're going to review current integrative treatments for anxiety. And as I mentioned, integrative medicine includes conventional and non-conventional approaches. I'm just going to review the non-conventional approaches because for time concerns. And then I'll present a case study at the end, which will hopefully speak up a little bit. Yeah. Can you hear? Is this good? Can you hear me back there in the back? Okay. Yeah. Okay. I'm going to present a case study at the end. So what is integrative medicine? Sort of a difficult question to answer, but if we look at the noun definition of the word, we get a sense of what this might be. To integrate is to form into one whole, to make entire, to complete, to renew, to restore, to reconstitute. It's holistic in its orientation by emphasizing care of the biological, somatic, emotional, cognitive, and energetic and spiritual dimensions of the self. And when I refer to energy in this talk, I'm not referring to gross physical biochemical energetic processes. I'm talking about subtle energies, referred to in the East by terms like prana and chi. Integrative medicine draws on conventional and non-conventional healing systems. And it's not another name for complementary or alternative medicine. Instead, it uses complementary and alternative medicine when it's appropriate for a specific patient. So taking a quick look at the difference between conventional and non-conventional modalities. Conventional modalities, and I'm referring here basically to contemporary modern allopathic biomedicine. Diagnoses are largely seen to be separate and unrelated to other diagnoses. These are generalities, so there are some exceptions. Symptoms are seen as local expressions of a disturbance in organ function. The focus of the treatment is on elimination of the disease mechanism through either usually a drug or surgical regimen. But in our field, we have established psychotherapies, conventional psychotherapies that seek to do the same thing. It's largely based on reductionism, or the idea that a system can best be understood by breaking it up and analyzing its component parts. When you look at non-conventional approaches, there's a notion that diagnoses are all related to one another and stem from some sort of core imbalance that leads to a multiple symptom formation or pattern. The goal in a non-conventional treatment modalities is to improve well-being, to establish harmony, and to restore autonomy in a patient who's coming to us because their life has fallen into discord on a variety of levels. It's patient-centered. The treatment plan is individualized, and it's based on systems theory, which basically says that a system can best be understood by taking a look at the relationships of component parts. In health, in systems theory is thought to be an emergent property of an integrated human. So kinds of non-conventional medicine, this is where we get into defining alternative and complementary medicine. Alternative medicines are based on healing models outside of the Western biomedical framework. Chinese medicine, homeopathy, Ayurveda are examples of this. They have their own theory of disease, etiology, pathophysiology, treatment, and usually a unique worldview that often is attractive to particular patient populations. Complementary medicine is based on mainstream biomedical theory and has a mainstream evidence base, but it's usually not mainstream practice for a number of reasons, perhaps social or political reasons, and forms of complementary medicine include herbal therapy and biofeedback. So getting back to the question, what is integrative? I found this quote by Larry Dossey, who's done a lot of work within the field, and I think it pretty much sums it up. He says that integrative medicine strives to attend not only to the physiological functions of the body, which is the primary focus of conventional medicine, but also to the psychological, energetic, and spiritual domains of people's lives. So integrative medicine also recognizes that healing or the restoration of wholeness can occur in the absence of a disease state change. And it encourages collaboration in treatment planning and goal setting. And the integrative practitioner functions as the head of a multidisciplinary team. So why use an integrative approach? There's a number of reasons. For one, there's growing discontent with strictly conventional approaches. Patients have identified cost, safety, concerns for efficacy of the treatments they receive, the impersonal manner in which care is delivered, and the need for a medicinal system to reflect their own values. There's also recently been increased use of non-conventional modalities. In 2002, about 72 million U.S. adults used some sort of non-conventional treatment for a health condition. And if you add prayer to that, and by prayer I mean directive prayer, for improved health in self or other, that number doubles. And in our field, individuals diagnosed with a psychiatric disorder are more likely to use non-conventional treatments, and they're less likely to report these treatments to their providers. One study showed that 2/3 of severely depressed or anxious folks use some sort of non-conventional approach. So now we're going to get into looking at anxiety from an integrative perspective, and as I mentioned, we'll have a little bit of fun with this. This is a painting done by George Gree entitled Panic Attack. And if any of you have ever experienced a panic attack or have heard a patient describe a panic attack, I think the imagery in this painting is pretty evocative of that. You've got a train rushing through the desert and a big torrent of water getting ready to collapse upon it. This is a painting done by Robert Dye entitled Anxiety, possibly reflecting the cognitive strain inherent in certain worry states. And this is a piece entitled Separation Anxiety. I was trying to kind of interpret this or analyze it, and I kept getting stuck on the apparent phallic-looking nature of the eyeballs. I couldn't get past that, so I thought I'd leave it up to you in terms of an interpretation. But I liked it. I don't know what that says about me. Maybe there's an analyst out here that can help me. So some famous, or quotes from famous people about anxiety. Richard Abel said, anxiety is the space between the now and the then, indicating kind of a temporal quality to worry. Ralph Waldo Emerson famously said, the solar system has no anxiety about its reputation, possibly indicating that anxiety, or at least higher formulations of anxiety, are unique to human beings. And then T.S. Eliot rightly understood that anxiety doesn't have to be a bad thing when he said it was the handmaiden of modern creativity. Can you guys hear me okay? Yeah? Okay. And then a cartoon here just to remind ourselves that based on the way we interact and treat with patients, we can either alleviate or induce anxiety. And that's important in integrative medicine, really focusing on an empathic patient-provider relationship. In the cartoon, he says, "Oh, don't worry, Mrs. Davidson. It's only a small microchip implant behind the ear. No one with a clear conscience need have any concern." So anxiety from an integrative perspective, this first bullet is kind of my working definition. It can be described as an experience of tension or disharmony, either conscious or unconscious, within different levels of a human being. And those levels include biological levels, gross somatic, body levels, psychological levels, interpersonal or social levels, spiritual or energetic levels. Anxiety isn't necessarily pathological, but can become so. And there's the notion that anxiety or distress within one level can spill over or manifest itself in a different level. So, and I've got some examples here. There's plenty more that I'm sure we could think about if we had time, but generalized anxiety or chronic worry leading to tension, pain, which would represent possibly a cognitive to somatic shift. Elevated thyroid hormone leading to panic attacks, panic disorder, which would represent a biological to somatic shift. Existential concerns, anxiety, leading to isolation, fear of connecting with others, that could represent a spiritual to interpersonal shift. So the key is to try and discern the location of the primary disturbance, while addressing its manifestations in the various different levels. And paying attention to the meanings that patients associate with their symptoms can give clues as to where the primary disturbance is. So moving on to integrative assessment and treatment planning. Begins with a thorough biopsychosocial and spiritual history, identifies symptom patterns present for the patient you're working with and the associated meanings or the causes that they attribute to their symptoms. Then we attempt to rule out other psychiatric, medical, or substance abuse comorbidities. And then we take a look at, in detail, conventional and non-conventional treatments that have worked for this particular patient in the past. It's not about reinventing the wheel. It's about using what works. And occasionally a patient has used something in the past, conventional or non-conventional, that they've stopped using for whatever reason, and a reasonable approach is to go back to that. So assessment leads to a multi-level formulation upon which initial treatment recommendations may be made. Uses evidence-based, outcomes-based, and anecdotal support in providing treatment recommendations. And also takes into consideration financial constraints, insurance limitations, availability of the specific treatment or the provider, which can be a big issue, and patient preferences. Someone who has a fear of needles probably isn't the best candidate initially for acupuncture, and I've seen that on a number of different occasions. Treatment planning pretty much always emphasizes the importance of self-directed approaches. And what I mean by that are dietary changes, exercise, and mind-body practices, mainly because these practices aren't associated with a lot of safety concerns, provided that you're in relatively good shape. Treatment goals and a time frame to achieve those goals are negotiated in a spirit of collaboration. Follow-up appointments are arranged and the treatment plan is revised. The treatment plan is a work in progress. And it's based upon, or the revision of the treatment plan is based upon new assessment data and the initial response to the treatments recommended. So now we're going to get into looking at a couple of different non-conventional assessment approaches for anxiety. You see here a Chinese medicinal practitioner doing a pulse diagnosis, which is very important within traditional Chinese medicine. So serum cholesterol has been shown to be possibly a biomarker for different anxiety syndromes, including generalized anxiety, panic disorder, and OCD, meaning that total serum cholesterol is often elevated in these conditions. Also, the response of anxiety symptoms to conventional treatments is often associated with reduction of total cholesterol. There's probably reason to look at levels of magnesium, selenium, and phosphorus, as deficiencies can often cause anxiety or contribute to anxiety, along with vitamin deficiencies, B6, thiamine, niacin, vitamin E, and vitamin E. There's also the notion that urinary glutamate levels may correspond to the severity of anxiety. Glutamic acid is an excitatory neurotransmitter in the brain, and the basic idea is that the higher levels of glutamic acid there are, the more its metabolite shows up in the urine. So energetic or informational assessment approaches that can be used. The quantitative electroencephalography is perhaps sensitive but not specific for identifying anxiety syndromes. Studies have shown decreased alpha waves or alpha wave production in generalized anxiety, increased theta waves in obsessive compulsive patients, and not surprisingly, paroxysmal activity in patients with panic disorder. Heart rate variability is interesting. It refers to minute fluctuations in the RR interval that are based on the respiratory effect of the heart. And one study showed that individuals who were rated as highly anxious, according to the Minnesota Multiphasic Personality Inventory, had lower heart rate variability. So we're going to move on now to the integrative treatment of anxiety. I guess before we do that, there's also a number of conventional assessment approaches we use too, the structured clinical interview, various psychometric tests, and laboratory analysis that I didn't talk about. So conventional treatments include pharmacological remedies and standard psychotherapies. Non-conventional treatments are aimed at the biological, the somatic or mind-body level, and the energetic or informational level. So biological approaches include medicinal herbs, amino acid precursors, and vitamins. Somatic or mind-body treatments include yoga, meditation, exercise, massage, and progressive muscle relaxation, to name a few. Energetic approaches or informational approaches include biofeedback, acupuncture, and a whole host of energy medicines that are available right now. So looking at non-conventional biological treatments for anxiety, it's a handful of what looks to me like Chinese herbs. So kava kava has a long historical tradition of use in Polynesian cultures for ceremonial and recreational purposes. It's thought to bind to and agonize GABA receptors. There was one study that showed, actually it was a review study of 11 controlled double-blinded studies with over 600 patients that concluded kava was superior to placebo in patients with generalized anxiety disorder. So it's effective, but it's not being used a lot, probably because of safety concerns, and we'll get into that in the next slide. The recommended dose is between 60 to 300 milligrams a day, and that's at 70% standardized kava lactones. You can get this in an alcohol tincture, in pills and teas, and you want to be careful in recommending the alcohol-based tincture to patients with substance abuse or a history of substance abuse problems. Kava is not thought to cause impaired cognitive function like benzodiazepines can. So safety issues, it's generally well tolerated. Sometimes patients will complain of GI distress, benign rash, headache, dizziness. It can cross-react or potentiate the effects of benzodiazepines. So you really don't want to use them together. If you do, you want to pay close attention to mental status of the patient you're working with. But it's not thought to potentiate the effects of alcohol. So the biggest concern with kava are the cases of hepatitis and liver failure that have been reported, which led to an FDA warning. I don't have the exact numbers, but it's very minimal compared to the extent at which kava is being used. You can get kava virtually anywhere now. And also, independent experts have concluded that most cases of liver failure and liver toxicity were the result of a single processing mistake in Europe, resulting in toxic levels of the alkaloid. That said, you still want to restrict or monitor the use of kava in patients with hepatic disease, alcohol abuse or on concurrent conventional hypnotics. Yeah.
Professional comment.
Yeah.
Did anything come up about rebound effect anxiety?
Rebound anxiety?
Yeah. Did they comment?
I haven't seen that. No, I haven't seen that. I didn't see that anywhere. But yeah, it's a good question. L-theanine is an agent that I've used frequently with anxious individuals, specifically with anxious individuals that have a difficult time concentrating. It's an amino acid extracted usually from green tea, and it's thought to be the component in green tea that counteracts the stimulating effects from caffeine. It achieves anxiolysis through increased GABA synthesis and through enhanced alpha wave production in the occipital and parietal regions of the brain. The dosage range is between 500 to 800 milligrams daily in divided doses. More severe anxiety symptoms often require higher doses. You can use it as a PRN or you can schedule it if you need to. It's not been associated with tolerance or dependence, and it's thought to have beneficial effects on blood pressure. It doesn't cause drowsiness, slowed reflexes, or impaired concentration. In fact, it often improves concentration. So dietary changes, patients with anxiety, we want to have them avoid caffeine, which has been shown in chronic use to raise serum epinephrine, norepinephrine, and cortisol levels, can lead to nervousness in normal individuals and increased panic and generalized anxiety in patients that have a predisposition to that. We want to instruct patients to avoid foods with a high glycemic index because of the risk of reactive or rebound hypoglycemia and the association of that with generalized anxiety. We want to encourage a diet rich in tryptophan, as deficiencies can lead to reduced brain serotonin. So just a few more non-conventional biological treatments that may be useful in anxiety. Ashwagandha is an Ayurvedic herb that has a very long historical use. It's thought to have anxiety-reducing effects by mediating the inhibition of stress-induced dopamine receptors. 5-HTP can be used as an anxiolytic, and it can be safely combined with SSRIs. However, the starting dose should be low, and you should monitor for signs of serotonin syndrome, which include insomnia, agitation, and anxiety. The dose is about 100 milligrams 3 times a day, and if you use increased doses at night, you can improve or potentially improve sleep quality and reduce daytime anxiety. Aromatherapy, lavender, rosemary, essential oils can reduce anxiety. There was one study on Bach flower remedies that showed the use of rescue remedy before taking a test reduced test-taking anxiety. And then supplementation can be helpful too, especially if there's a deficiency. Magnesium, B6, B12, vitamin C, and vitamin E, along with phosphorus and perhaps inositol for panic attacks. So moving on to somatic or mind-body treatments. One of my favorite activities here. So applied relaxation refers to a number of techniques that can be used. Deep breathing, progressive muscle relaxation, guided imagery. It's useful as a self-care regimen for patients with generalized anxiety. It's fairly safe, perhaps with the exception of panic disorder. You may not want to use relaxation techniques in individuals with panic disorder because it can exacerbate or cause panic attacks. Imagery is specifically useful because it can be tailored to specific anxiety symptoms and has been shown to have beneficial effects on immune system function and stress physiology. And guided imagery has been shown to reduce generalized anxiety and the anxiety associated with intrusive traumatic memories in patients with PTSD. Moving on to yoga, this is standing bow pose. So, open studies, anecdotal evidence, and an extremely long historical tradition support the use of yoga or regular yoga, a regular yoga practice for the treatment of anxiety. There's a specific type of yoga called Sudarshan Kriya. Has anyone heard of that by chance? No? Okay, good. Because I tried to find out about it, and I couldn't find. All I found out that there was one study that showed that it decreased cortisol levels, but it's a yogic practice promoted by Sri Sri Ravi Shankar, who has his Art of Living Foundation Society. And you can't really learn about it unless you join the society, which may be a limitation inherent in it. But so regular yoga practice has been shown to reduce the need for conventional drugs in patients with generalized anxiety. And just the last bullet here is, patients with cardiovascular chronic pain syndromes or other physical impairments should consult a physician before embarking on a yoga practice. So moving on to meditation and mindfulness training. A regular practice has been shown to be beneficial in terms of its effect on certain autonomic parameters, including respiratory rate and blood pressure. And there's been EEG changes that reflect the decreased autonomic arousal that can occur with sustained practice. And then mindfulness-based stress reduction is a particular type of integrated mindfulness therapy that was created by John Kabat-Zinn, who's a pioneer in the field. It combines mindfulness training, certain tenets of cognitive therapy, or cognitive therapy exercises, and yoga into an 8-week intensive program. And there's been a fair amount of research on the effect of this particular protocol on anxiety. To go over one study with an N of 322, the majority of the participants who completed the protocol reported decreased emotional distress, improved quality of life, and increased feelings of control. And 93% completed the study. Moving on, animal-facilitated psychotherapy can be useful. Regular pet contact or contact with a domesticated animal during psychotherapy has beneficial physical and psychological responses. And we're seeing a rise in the use of equine therapy in particular for anxiety conditions and particularly PTSD. So energetic treatments, subtle energetic treatments, what you're seeing is acupuncture needles going into some sort of meridian system. So biofeedback, just to review what it is, it measures quantifiable bodily functions such as heart rate, blood pressure, temperature, and conveys that information to patients in a real-time here and now setting. And the attempt is to raise the patient's awareness of those parameters and to introduce techniques such as breathing techniques that allow the patient to begin to consciously control or regulate some of these functions. So there's different kinds of biofeedback. EMG, EEG biofeedback training have been shown to be effective for generalized anxiety disorder. Chronically anxious patients trained in biofeedback can achieve symptom reduction similar to patients taking conventional drugs. And biofeedback training using heart rate variability shows through numerous case reports benefits in generalized anxiety. So this is my favorite, actually. and I haven't used it myself or actually had a patient use it, but I really like the concept. Virtual reality graded exposure therapy. The goal is to, actually what happens is you use a virtual reality technology to induce or to create whatever the feared object is or feared situation is. And the goal is to gradually desensitize a patient to the feared object or situation. It's been shown to be more effective than just basic imaginal exposure therapy and has comparable efficacy to in vivo exposure therapy. It's been shown to be effective for the treatment of specific phobia and panic disorder along with PTSD, and is effective for acrophobia or the fear of flying. So this is a virtual reality session, and what you can see is that the patient is wearing these goggles that create a three-dimensional image of whatever issue she's trying to work on. And the therapist has the ability to amp up the intensity of the stimulus based upon where the patient's at. And they'll often measure heart rate and other parameters to kind of tailor the level of exposure to the patient's ability to tolerate what's going on. So it's another form of exposure therapy. So this is an image from a session on fear of flying. And this is an image from someone with PTSD, again trying to introducing through virtual reality exposure. So it's available over the internet too, and if you do a search, you can find specific protocols, or you can find programs on the internet that you can sit and watch. It's probably not as effective because you're not using virtual reality technology, you're just using two-dimensional images. It's cost effective. It shouldn't be used in folks with psychosis because of the potential to worsen reality testing. And it's been shown to exacerbate migraine headaches or contribute to or worsen vestibular problems. So acupuncture, extensive case reports from the Chinese medical literature suggest that acupuncture or certain protocols of acupuncture can be useful in generalized anxiety disorder. But a narrative review by the British Acupuncture Council of controlled and outcome studies failed to establish a difference between sham acupuncture treatments and actual treatments. What they found actually was that patients responded regardless of where the needle was put. So if the needle was put in the exact meridian or a number of different meridians, the patients responded. If they were put in non-meridian locations, they responded to, and I'm not sure what to make of that. However, in a majority of the actual treatments, heart rate variability increased, which is a good thing, and resting heart rate decreased. Okay, so trying to put this together in a case study. This is an individual I worked with on a number of occasions out at Sierra Tucson. He's a 39-year-old single male engineer with a reported history of anxiety and nervousness, difficulty making important decisions, problem sustaining focus, which had cost him a number of important relationships. He'd recently broken up with his partner of 3 years because he couldn't commit, and employment promotions. He noted a history of public speaking anxiety and occasional panic attacks. He felt, as a result of dealing with his anxiety, he felt energetically depleted and keyed up at night, which led to sleep problems. He had initial and middle insomnia. He interpreted his symptoms and interpersonal failures as a wake-up call to change his life course. So additional important parts of his history: his parents divorced when he was 8 years old. Prominent issue for him was never feeling comfortable in his father's presence, who would often shame him when he would try something new or initiate new behaviors. He could never do things good enough according to his father. And his father would beat him occasionally, which is obviously not a good thing. He felt a general lack of purpose and meaning in his life and basically felt stuck. He was raised Jewish, but had kind of fallen out of the faith and had recently begun to explore Eastern spiritual practices. He said his mother took pills for anxiety or stress, but he couldn't identify any other psychiatric family history. He had no history of substance abuse or head trauma. His goal for the admission was to learn how to deal with his anxiety and to make committed decisions. He was very highly motivated. He also said, when I brought up the topic of medications, that he would not, he adamantly stated that he would not be interested in psychotropic medications, but would be open to herbal therapy and nutrition. And when asked why, he said it was because he was medication sensitive. He had had a bad response. He had been tried on Adderall as a kid and had a really bad reaction to it. I can't remember what it was. So we reviewed prior non-conventional treatments that he had used, which included Swedish massage, acupuncture, GABA supplementation, hatha yoga. And of the four, he perceived acupuncture and yoga to be particularly helpful. So we did a thorough medical examination and lab analysis, which failed to reveal a biological cause for his anxiety. He went under a series of psychometric testing, including the Milan or the Millen Clinical Multi-Axial Inventory, which revealed generalized anxiety and avoidant personality features. And initially, he agreed to a trial of valerian root for sleep and PRN L-theanine at 100 milligrams for anxiety. Okay, so trying to formulate this guy from an integrative perspective. On a biological level, we could say that he inherited a generic predisposition for anxiety from his mother. And I've started psychological because, in my view, this area represented the core. In this domain, I feel like this is where the core trauma was. Chronic trauma and self-development in a shaming environment led to social anxiety and isolative behaviors. From an energetic perspective, the chronicity of his symptoms had led to feelings of depletion despite no biophysical correlations in his lab profile. In the interpretation of his symptoms as a wake-up call, possibly reflected a drive from his spiritual self to change his life course. So the treatment plan that we came up with, the initial treatment plan, as I mentioned, was to add valerian root and L-theanine. He received a nutritional consultation. He received individual and group psychotherapy and was enrolled in psychodrama, which is a type of experiential therapy where he was with the purpose of looking at the socially anxious components of himself. He was started in EMDR for trauma and had family therapy during Family Week. He was given a career scope assessment profile to help him clarify his skills, talents, and interests. He was started in acupuncture, massage, and yoga. And he was given a spiritual and grief consultation. So case history follow-up. Acupuncture revealed liver qi stagnation. He was given 8 treatments. The grief and spiritual consult recommended a mindfulness meditation protocol for stress management, which he participated in. Nutritional consult recommended decreasing foods with a high glycemic index and the addition of omega-3 fatty acids for proposed mood stabilization. And in psychodrama, as I mentioned, he began to work on feelings of unresolved shame and of being judged in social situations. So in follow-up, he noted improved sleep quality and quantity with valerian root. He noticed some diminished generalized anxiety and improved focus with PRN-L-theanine and appreciated a subjective benefit from EMDR. However, he continued to have social anxiety, pretty intense anxiety in group setting, which prevented him, he felt, from opening up more in group. So at this point, we revised the treatment plan and decided to opt for a trial of Lexapro. And in retrospect, I started him at 10 milligrams, and it was probably too high a dose given his assertion that he was sensitive. And in fact, he did react. He became activated on Lexapro, stopped the medication, and agreed to a trial of 1/4 of that dose at 2.5 milligrams daily. On 2.5 milligrams a day, he did quite well. He didn't experience the activation. Throughout the next 2 weeks, he reported decreased feelings of being judged and improved mood. He felt energetically restored and looked better. You could tell there was a shift in him. Family therapy was interesting. It didn't affect or improve his relationship with his father, but it did give him a safe platform to assert himself and his concerns about his prior trauma. So his discharge plan included individual therapy, continued acupuncture, yoga, and group psychotherapy. So some of the highlights that maybe reflect what I was talking about when introducing an integrative model. We used both conventional and non-conventional approaches with him, and we paid particular attention to the CAM or non-conventional approaches that had worked for him in the past, which included acupuncture and yoga. There was a point at which we revised the treatment plan when the L-theanine wasn't working to diminish his social anxiety. We added an SSRI. And as I'm postulating, the original trauma, the original psychological trauma, generated biologic, energetic, and existential spiritual problems, which were addressed during the course of his treatment. That's it. So the light at the end of the tunnel. Some internet resources that should be available in your slide package, and then a list of references. And it looks like we have time for a couple questions. Non-conventional psychotherapies? Yeah, actually there's quite a few. And I couldn't add everything in the talk because of time constraints, but there's a number of energy-based psychotherapies that are available right now. EFT, or emotional freedom technique, is one. WE is another one. EFT is interesting. It involves tapping of acupressure points while recalling anxiety or anxiety-provoking memories or specific phobias. And I don't know how beneficial it is, though. I mean, people do use it, though. Yeah.
Along those lines, any comments on the use of implosive therapy, flooding?
Flooding?
Flooding.
Yeah. Yeah.
Therapy. Back in the pioneer days of residency training here, it was quite a
Right.
quite a number of people on the psychology staff I know that
You would. Right.
this, and I was always really rather intrigued as to why it's not being. You don't read about too much of that.
Yeah, well, that would be considered a conventional approach. It's a cognitive behavioral approach. I know that it is still used, but I think I think that it's not used perhaps as frequently as it was in the past because there's different ways of addressing those problems through systematic desensitization, perhaps. But the gentleman behind you might be able to say a little bit more about that. Take the focus off me.
I think what you said was a fine summary.
Okay. Betsy?
Why is applied relaxation contraindicated in panic?
It's not uniformly contraindicated, but it can lead to, my understanding is that it can lead to a panic response. And the thought is that, I believe the thought is that when someone with panic disorder begins to experience the relaxation involved in certain breathing techniques, the heart rate goes down, the breathing rate goes down. And then when they stop, you get a rebound acceleration in the heart rate, which can be interpreted as panic symptoms, or that can, cause a panic attack, more or less. Because patients with panic disorder are usually particularly sensitive to physiologic functions. But
When talking about the foods, tryptophan, I don't know what foods are high in tryptophan.
Turkey.
Turkey. What else?
Other protein sources. I'm not off the top of my head, I'm not exactly sure. But it's, yeah.
Meats, certain nuts.
Nuts, that's
but
right.
primarily protein stuff is an amino acid. It's part of the structure of the
Yeah.
milk.
It's pretty prevalent. Meats and nuts. Okay, thank you.